Hello there, my name is James. I'm an Associate Veterinarian here at the Box Hill Veterinary Hospital in Victoria, Australia. And this is one of my senior nurses, Anne.
Hi, I'm Anne and I work at the clinic here and assist James with all the animals. I've been working here for over 30 years. We've also got some equipment that we need to have ready before we actually take the animal out of the cage.
Set of gloves?
Yes, so these are welding gloves. So when you place these on your arms, they're quite thick material, so it protects your arms. Also, if the animal bites, it doesn't penetrate through the glove. So sometimes we're faced with aggressive cats, but we need to also make that a very low stress procedure to get them into the cage. So if you have a cat in another cage and you're wanting to put the cat into a crush cage, we just make sure that we place a towel over the crush cage, which creates a dark environment for the cat. It's probably a good idea to still wear the gloves, just to make sure that the cat doesn't swipe you through the cage. And then holding the cage up to the other cage where the cat would be and allowing the cat to walk in by itself, which it will do if the cage is dark and we take the towel off the other cage. Sometimes people say you can gently just blow some air onto the cat just to encourage it to go in, and then place the door on. And then if we need to inject the cat, we can gently move the cat up to the end and place the needle through the cage at different angles, depending on where the cat's sitting. But all the time being aware that we want to make this a low stress experience for the animal. Sometimes we have clients call up the clinic and they might be having difficulties with getting their cat to the clinic because it might be aggressive or they don't have a carry cage. So another alternative is to use a pillow slip that they can place the cat gently into. And tie the bag up, and then they can carry the cat gently to the vet, and if the cat is quite an aggressive cat, the vet's able to inject through the pillow slip, so we don't actually have to get the cat out of the bag. So I'm going to get the cat out now. We need to keep noise to a minimum and remember again to make sure all the doors and the windows are kept closed. We keep the cat in a cage that's elevated from the floor because cats prefer to be elevated from the floor rather than be sitting on the floor in cages. And also, if you notice, we don't have any dogs in the same room. That's a very important point as well, because otherwise you're just building up their stress levels, which is going to make it harder for you to handle. For the cat's comfort, we make sure it's got a litter tray as well whilst it's staying in the hospital. If it's having a procedure, obviously it doesn't have food and water in there, but afterwards it will on its recovery. So approach the cat gently and quietly. So we pop him down onto the towel. We just pop the towel here ready, just in case he gets anxious or aggressive. Okay, so Simba's getting a little bit upset about being at the veterinary clinic today, which is okay, although we're trying to minimise his stress. So we're going to put him into a wrap, so we're still able to examine him, but he'll feel a little bit more secure. So making sure that his front legs are contained. You can actually still hold his front legs from under the towel under here with this arm, And this arm is holding him in close to my body to keep him nice and secure. So if James needs to check his eyes, he's still able to, or his ears in this position. And also in his mouth.
He doesn't have many teeth. He's only got 4 teeth.
I know. And if we're needing to examine the back end of the cat, and he's still, feeling a little bit anxious, we can pop his head actually under the towel, and all the time being very gentle. So if we need to take his temperature, or examine a limb from the back, he still feels fairly secure and still restrained. So James is just putting some alcohol on his skin.
Come on, buddy. 1, 2, 3, ouch.
And then just trying to divert his attention.
Come on, buddy. Come on, buddy.
While we take some blood.
Come on, buddy.
It's okay, Simba.
Come on, buddy.
It's okay.
Come on, buddy. Okay, that's enough.
And then we just apply pressure, gentle pressure there.
Come on. Hold on. Now note where we took the blood from in Simba. We took it from his neck, from his jugular vein. In cats and small dogs, you'll find this is much easier than getting from the cephalic vein in the leg. We can get a better volume, we can get the sample much quicker, and it also saves the veins in the legs for use with catheters and intravenous drugs.
So sometimes the cats will get aggressive, so we can scruff them, which, as you can see, Simba doesn't like being scruffed, and then we pop them back into the cage. And then place the towel over them so they can relax and just calm down.